Hello, my guys. My name is Teresa Easy, and I'm so glad to be here. I'm so thankful to God that I'm alive. And welcome to my channel. If you haven't subscribed, what are you waiting for? If you haven't liked, go ahead and like all my videos and also share. Okay, so in this channel we do a lot of learning. We are learning together. We are edifying each other. So today we're going to talk about human immunodeficiency virus, which is also known as HIV. So I know when I was in high school, we had this pandemic in Kenya about HIV, and everybody was so scared. The society at large, the government, when it declared it as a pandemic, it was awful, right? And everybody was so scared. So I have a little topic or slides here so that we can go ahead and see what is happening right now. And this is evidence-based research. This information is credible, and there is citation, so it's not something that I'm just googling from somewhere in the Google. No, I'm also a public health nurse and a graduate and also a graduate student right now. Okay, I'm continuing with my education as a FNP, a family nurse practitioner or nurse practitioner. So let us grow together and let also learn about the preventables. So preventing the preventables, not waiting for people to get sick and go to the hospital. So we prevent it from the community at large. Okay, so let's go ahead. Let's see what the global and regional trends are, right? Okay, so next slide. Oh no, don't fail me. Don't fail me. Okay, there we go. So, global and regional trends. In 2022, approximately 39 million people globally lived with HIV, and this is by UNICEF. Children are part of those affected by the epidemic. 2.58 million were children aged between 1 to 19 years, and daily 740 children are infected with HIV. Approximately 274 children die daily from AIDS, and death attributed to lack of adequate care and treatment. So, and also UNICEF provided the above statistic on HIV infection globally as in 2022. Evidence from the organization's research show that 39 million people lived with HIV as at 2022, and we can see that children are being affected because they are lacking enough lack of care and access of treatment, and strides need to be made in early diagnosis, responses, prevention, and treatment. So let's go to HIV transmission and epidemiology. HIV, how is it HIV transmitted? Many people don't know how they can catch HIV, and I don't blame them. That's why education as a public health nurse, it's very, very important to educate people, or even nurses and doctors in general, and social workers. If you are in the medical field, it's good to educate people, because if they have the knowledge, then they will know what to do. They'll know what to do, or what they can do to prevent themselves from getting this kind of transmittable diseases. So HIV is transmitted through sexual contact, blood contact, and also sharing injectables or sharing needles. There is also postpartum transmission occur through breastfeeding or egg bath. And sub-Saharan Africa account for 67% of global HIV cases, and this is 25.4 million. WHO is World Health Organization 2023. Central Asia and Eastern Europe have had HIV infection rise by 47% by 2022, and most infected people include transgenders, sex workers, and MSM, men having sex with men. HIV positive people still face stigma and also discrimination in most of the places. So let's go to the next slide. So you have seen the numbers there. So sub-Saharan Africa account for 67% of global HIV cases. So please, 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 let us continue protecting ourselves. If you're having a new partner, make sure that you're getting tested before you have an intercourse. And if you cannot abstain from having sex, I would urge you to protect yourself with use of a condom. Okay. Okay, what are the clinical signs and symptoms? 90% of infected people experience symptoms during acute HIV phase, according to CDC. Signs and symptoms vary from one person to another, so everybody is unique. Majority of infected people experience influenza-like syndrome. Some signs could start 10 days after infection, that is fever and having headache. Stage 3, which is symptomatic, present skin rash, oral ulcers, and weight loss, and that's also according to CDC. So where such symptoms exist, it's always good to have HIV test and diagnose as required. So let's go back there. So stage 1 of HIV is infection, followed by stage 2, which is asymptomatic, and then stage 3 is symptomatic, that meaning you have symptoms, and 90% of the people start experiencing the signs and symptoms at the third stage. So it's very, very again early to tell if you have acquired HIV or not during stage 1, and this is why it's very vital, if you have a new partner, or if you suspect maybe your partner is cheating or has multiple partners, it's always good to go get checked just to make sure. Go get tested, and also abstaining if you can. And yeah, and then after abstaining and you get tested and you guys are okay, then you have to continue being faithful, because guess what, you can abstain today and tomorrow you get tested, you have negative results, and then you start sleeping around with other women or other men, multiple partners, then you might catch it again. So just be careful. Let us try to protect ourselves from diseases that we can protect ourselves from. There's some diseases that we cannot even control, but those for sure that we know we can protect ourselves from. Let's try to be kind with ourselves. If you meet somebody who is new, if you meet a partner who is new, please get tested or just use a condom or abstain. Okay, whereas in others they experience influenza-like symptoms, others start observing skin rashes, oral ulcers, like little wound in the mouth, having diarrhea and fever, hiking temperature or spiking temperature. Later, it followed by weight loss and prolonged fatigue. Whenever signs such as oral ulcers persist, test and early diagnosis of HIV infection should be done, and this is by CDC. Okay, so I was curious to see what is happening to my country, Kenya, because Kenya is also in sub-Saharan Africa, in the East Africa region. So approximately 1.6 million people are living with HIV/AIDS, and 1.1 million children have been orphaned by HIV/AIDS. Kenya reported its first HIV infection in 1984. The disease was a major cause of illnesses and deaths in 1990s, leading to early 2000s. Presently, 1.6 million Kenyans are infected with HIV, at least 6% of the population. More than 1.1 million children have been orphaned as a result of the parents' death. Some of the countries where HIV has ravaged include Homa Bay, which leads with an infection rate of 42.4. Kisumu is second with a rate of 41.6. Here comes that with an infection rate of 34.5. Others are Migori at 30.9%, and Nairobi with an HIV infection rate at 30.5. And here comes to my Nairobian people. I know we like to party. We like to party. So just be careful because you can see the rates. I know sometimes when it was declared pandemic, the school was involved, the social worker, the nurses, the public health nurses of Kenya, they were involved, and there was this sex education that we were given, being showed pictures about HIV. But right now it's like we have forgotten because we don't talk about it anymore. It's like it sees, it's like it's not there, but you can see it's still there. So protect yourself and get tested. So you have the numbers about HIV in Kenya. So please, 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 if you're outside there, you're having multiple partners, and you know that you are sick, protect your loved one from spreading the virus. Okay. So one next one. So HIV treatment and prevention. Thanks goodness, because I feel like HIV did affect me and also affect me, because I lost my loved. I lost two people that are very close to me, my loved ones, and they died when I was in high school. That is when the government had declared it as a pandemic. So I know, and they didn't have ART those days. So I'm just thankful that, with the technology and the research, people are able to survive for many, many, many years with ART. And sometimes I pray and wish if the ART and the HIV meds were there when my loved one died, my uncle died, and he was my favorite uncle. So timely diagnosis of HIV infection is the key to its treatment and prevention for transmitting to others. ART has been known as to reduce the viral load to undetectable level and also increase life expectancy. For HIV negative people that have sex with positive partners, they are advised to use PrEP, oral tablets, to reduce their chances of acquiring the virus. FDA further approved PrEP to be taken after single high-risk exposure to HIV infection from sexual intercourse or sharing needles and syringe with an infected person. So yeah, we have the PrEP. If you feel like sometimes your partner might tell you, you know what, I think I have cheated and I feel like we need to take a PrEP. So I think these medicine are also in Kenya. They are readily available. You can get them. You can take PrEP just to protect yourself, to prevent yourself from getting the HIV. Okay. So I think PrEP are also in Kenya. They are here too in USA. You can just go to any community health clinic and let them know that you are worried because you had sex, unprotected sex, and you'd like to get a PrEP. So I'm just glad that Kenya is making a lot of moves towards the healthcare department. So let's go to the next one. So USA response to HIV global epidemic. So in a bid to have a safe and secure world from infectious diseases, the US government launched PEPFAR in 2003. Since the USA has partnered with affected countries and aided them through Global Fund. So far by 2022, more than 64.5 million people were supported to test their status and start using the ART and the ARVs. So it's through the USA partnership with other countries that opportunistic infections such as TB have reduced and treatment for malaria also enhanced. Okay. So let's continue. HIV care continuum. So continuum of care basically covers the step taken after an HIV positive diagnosis is handed down. a patient has to reach a point where the virus is both undetectable and untransmittable. Stage 1 is the diagnosis of HIV, and this is where people go through a lot of trauma just thinking about it, like, is that death sentence? No, it is not anymore. So when you are told that you have HIV, do not worry, do not feel like this is a death sentence. There is medication now that you can take and live for many years ago. Not like when it came, it hit the country and we were all scared and we didn't know what to do, and a lot of people went through trauma, discrimination. They died. The family even left some of their family because they didn't want to get involved with them because they were scared they might get even HIV by just sharing a spoon or plate. Now we know that is not true. So stage 2 is getting linked to a medical care, and stage 3 is to start using medicine, and step 4 is adhering to medication. So again, talking to people in my country. So I know we have so many people who say, oh, my pastor can pray for me, and I'm not disregarding because I'm also very spiritual. But before you stop taking your medicine just because your pastor or your bishop or anybody has told you that now you are not HIV positive anymore, then go get checked first, and then you can talk to your doctor, of course, if you want to quit the medicine. But don't be lied by people who are so cruel. They don't care about your own health and tell you that I have prayed for you. I believe in prayers and healing, but just make sure that you see the doctor and let the doctors do the testing and see whether you're going to test negative or positive, and then you can discuss anything that you want with your doctor. Okay. So stage 5 is the assessment of the viral load to ensure that it has been suppressed to undetectable levels in the blood. That's making it difficult for you to infect others. Okay, and that's where we want it to be, suppressing it so that even if you have sex with your partner or your wife, your husband, that you're not spreading it to your partner. So next, so challenges in combating HIV AIDS. Worth noting is that once has been diagnosed with HIV, other co-infections such as TB come along the way, and I think that is what killed my uncle a long time ago. Those opportunistic diseases that come because the viral load was high. So I think he was diagnosed with TB, and that's what killed him. So that increases the burden of HIV treatment from an early stage. COVID-19 disruption as well affected the services that were in the place in treatment and prevention of new HIV infection. Furthermore, okay, so let's finish this. Somebody's calling me and I need to get that phone as soon as possible. And those are my references. That's where I got all this information. So this was just a small topic just to remind you people to protect yourself. I know we don't talk about HIV anymore, but it's still there. So protect yourself, and if you have been diagnosed with HIV, it's not the end of the world, and don't feel like like long time ago it was like, oh my gosh, I'm gonna die. No, you won't die. You'll stay in this world for a long time. Just make sure you're eating healthy, you're taking your medication, you are also following up with your doctor, and you're taking care of yourself. You're not just going there having sex with anybody. So that's the end of this topic. I'm gonna come with other two topics. We're gonna talk about gonorrhea and syphilis. For the HIV, I just wanted to remind people that it's still there, and let us protect ourselves. Let us prevent ourselves. If you're going outside there, try to protect, use a condom. Okay, use a condom, or abstain, so that we can continue improving our community. Okay, again, my name is Triza Easy. If you're new here, I'm a public health nurse or registered nurse, and I'm also a student. I'm working on my graduate degree to be a family nurse practitioner, so you pray for me. Okay, and I love teaching, I love educating my people. So a lot of you told me that I should pay more attention on the STD, sexually transmitted infections, and this is why I start with the HIV. Just remind you people that it's still there. Let us protect ourselves. Let us use condoms. Yeah, and if you have been diagnosed with HIV, feel loved, and don't feel like it's the end of the world. It is okay. Just continue staying a healthy lifestyle, and you will live for many, many, many years. Okay, so thank you so much, guys. Subscribe, like, and share. Subscribe again, like, and share. Thank you. I love you guys. Okay, bye.